Welcome everyone to the summer 2021 Climate and Health Internship Colloquium. We're so glad to have this great group together and we have a packed agenda from our fantastic students. First, I'll just take a minute to tell you that, that we're recording and that this will be available afterwards. And especially to give a welcome to preceptors who are here, who hosted our students over the summer. A couple session rules: please place yourself on mute while the panelists are presenting. You can enter your questions into the chat box. There will be a Q&A session at the end. Our agenda is a quick introduction to our center, and then we have 3 panels and then the Q&A session. So first, I'll just tell you the Yale Center on Climate Change and Health is a center that's based at the Yale School of Public Health. We work through research, education on public health practice to affect and address the health impacts of climate change, as well as identify the health co-benefits of climate action and push for addressing climate change, which we consider to be perhaps the greatest public health threat of the 21st century. We sponsor this internship program. We also have a new concentration in climate change and health that I want to especially make first year MPH students aware of. So MPH students from any of the departments are eligible to apply. So you would add it on top of your department. You'll be getting more information in mid-October, so about the application process. It's quite straightforward. And we have a number of the current concentration students as part of this internship cohort. With that, we're going to turn to our first panel. So this is climate and health on an international scale. And we have 3 students who are kind of stepping up to the virtual podium. Weixi Wu, Erika-ann Kim, and Rebecca Gillman. So each student will give a kind of a very quick couple-minute summary of their project and their organization, and then we'll shift to a panel discussion. So first up, Weixi.
Hi, everyone. So you guys can hear me okay? Okay, good. Hi, everyone. I'm Weixi. I'm a joint master degree student from the Department of Environmental Health Sciences in School of Public Health and Master of Environment Science in School of Environment. I'm on the concentration in global health, but I'm working as a student associate coordinator in Center on Climate Change and Health. So in the past summer, I worked with the Justicia on climate change litigation to identify the interlinkages between climate change, air quality, and human health from a human rights perspective. As shown on my presentation slide, the Justicia is a Colombia-based research and advocacy organization that uses law to promote social justice and human rights in Colombia and the Global South. Colombia is at high risk for climate change impacts. In urban areas, people are suffering water shortages and land instability, and the rise in temperature and changes in rainfall patterns can also have an impact on respiratory, cardiovascular, and waterborne diseases. And apart from urban areas, climate change has become a threat to Colombia's rich biodiversity. It causes the natural resources depletion and violates the basic human rights of indigenous populations to a healthy environment. In Colombian legal system, individuals are allowed to bring claims before local courts against the government, public entities, or private actors for not complying with national laws or international obligations related to climate change matters. So during this internship, we analyzed the legal terms and different case studies, both in Colombia and in other countries. And we're still in the process of completing the literature review. And for Colombia, the preliminary result we got from the internship is for Colombia, it is necessary to continue adopting preventative measures to anticipate further climate change impacts. Since up to now, all these measures they have taken, it's not sufficient to tackle this problem in the country.
Yeah. Great, thank you, Weixi. Next is Erika.
Hi, thank you. Thank you, Dr. Bazzi, and also thank you to everyone else at the Yale Center of Climate Change and Health for organizing this, and as usual, just doing amazing work. Hi, everyone. My name is Erica. I am a second-year MPH student at Yale School of Public Health in the Chronic Disease Epidemiology Department, and I'm also getting a concentration in climate change and health. So this past summer, I interned for the Eastern Caribbean Health Outcomes Network, or ECHORN. My preceptor was Dr. Saria Hassan from Emory-Rollins School of Public Health, and I worked on a qualitative study that aimed to assess the feasibility and acceptability of WHO NCD kits that are meant to be implemented after natural disasters in the Caribbean. And although the summer's over, I'm continuing to work on this project. We are actually still working on collecting more data and putting together a manuscript of our findings, which is really exciting. And so a little bit about how this project pertains to climate change and health. I mean, it's extremely pertinent to this field. For one, the Caribbean is a region that's especially prone to natural disasters, which will continue to get worse in severity due to climate change, and which is a huge public health threat, as I'm sure we all know. And second, in the past, a lot of emphasis has been put on addressing more immediate health consequences of disasters, such as like injuries that occur or trauma that occurs after disaster hits, or maybe like diseases that come about from the immediate impact of like a disaster. But there are other health consequences that play out in the longer term, such as complications from non-communicable diseases and also mental health outcomes. And these long-term consequences are responsible for a significant percentage of disaster-related mortality. And so a strength of our project is that we are helping to fill the gaps in understanding of what the experiences of people living with non-communicable diseases are during and following disasters. Thank you.
Great, thanks, Erica. Next is Rebecca.
Hello, everyone. Can you all hear me okay? Cool. Very, very cool work that everyone's doing. Very nice to meet everyone. I'm a second-year MPH candidate at the Yale School of Public Health, studying health policy with a concentration in climate change and health. This past summer, I worked with the NGO Earthmedic. I'm going to give a bit of background about the NGO just because it will make sense in context, I promise. So the NGO is very, very new. It was founded officially in April 2020. Which, as you guys can imagine, from a public health perspective, not a great time really to be starting anything, certainly not public health projects, but onward they go. So basically going into this internship, they didn't really have the capacity and still don't really have the capacity to do any of the work that they want to do. So it's sort of like, so I guess that's all to say my internship really focused on seeing what possible opportunities they had for participation in order for them to put their very limited resources to best use possible. So in particular, the director, the CEO, Dr. Hospitalis, was really interested in looking at how climate NGOs like Earthmedic, like others, could possibly get involved in UN initiatives as one possible way of influencing decisions and making sure that everything is more sustainable and more climate oriented. So the final product that we ended up coming up with is this project presentation here that will be presented actually in a couple of weeks. That's a little terrifying, at Yale's Climate Change and Health in Small Island Developing States conference. And the presentation title is there, but I will just read it. Climate and Health Initiatives in Small Island Developing States, overview and potential of NGO participation in UN processes. So essentially, I did a giant literature review all summer, but it's all very interesting to me because it very much relates to what I want to go into. I'm very much interested in going into environmental law and policy and really looking at the types of enforcement mechanisms that are possible. How can we really force all of these promises that these governments are making to actually go green? How can we actually make them follow through with these promises? Because they're great promises, but they're not really happening. So anyway, all's to say, I know my time's up, I'm sorry. It was a very interesting internship, and I was very glad that I was able to kind of mesh it with my future career goals.
Great. Yes, and good plug for the conference that's coming up. Hope folks can attend if they are available. Great. So I'm just going to go back to this and welcome all the participants back for some discussion questions. So, one thing I'm interested in, I think almost everyone was virtual, but some were virtual in a place that they knew. You were virtual with an international organization, perhaps a place that you'd never been. So tell me a little bit about how did you learn about that place and about that particular context in order to do this work? Did you were there some strategies or particular maybe things that you learned along the way that were helpful to give context to your research? Anyone can jump in.
Yeah. So for me, I've never been to Colombia, and I did my internship virtually. Before starting the internship, I had to write a research proposal. So I looked it up a lot of studies and papers that that conducted in Colombia. And then I think it really helped me a lot to understand the situations in Colombia. And also, because I have no law background or any litigation background. And I did also read through a lot of legal documents and then like the legal system in Colombia to give myself a context, like what Colombia legal system is like. Yeah, so it's mainly through reading. And then also like my preceptors from NGO also helped me a lot and answered a lot of my questions. And they also connected me with many professors in universities in Colombia. And then they're also very helpful in answering all my questions. Yeah.
Great.
Yeah, I can also kind of talk to this. I found my internship in general really transformative in building my understanding of climate change and health in the Caribbean, and so like in the region that this project is based in. When I first applied for this internship, last winter, I came into the position with like 3 kind of scattered interests: 1 in non-communicable disease, 2 in climate change, and 3, I had like a small existing interest in small island states because I was born and raised and educated up until college on an island myself, but I'm from the Pacific, not from the Caribbean. And so this project seemed really fitting. And now that I've been working on it for all this time, what was something I guess I didn't really see coming and I have really learned along the way is that through our qualitative findings, there are some very interesting similarities to me, I think, between the health problems that people in small island states face due to climate change. And going forward, it's part of my intellectual agenda to kind of bridge how islands across the globe kind of have similarities, as different and diverse as they are, in this problem that climate change poses and the health implications of that, and then creating solutions that maybe work for everyone.
I would say mine is sort of a mixture of both Weixi and Erika's answers. EarthMedic is based in Trinidad as its main headquarters, but the entire project was just about very general UN Caribbean NGO processes. So a lot of it, very similar to Weixi, was very much just reading, asking a lot of questions to my preceptor. My preceptor, Natasha, is just super wonderful. She's really well educated and was definitely able to fill in the gaps in knowledge that I didn't have. So I think that, at least from a professional perspective, we definitely complemented each other well, because I come more from the public health perspective of it and was kind of almost thinking of things like a research paper almost. And she would say, oh, well, yes, this, and yes, like these things are very cool, but like, from a legal perspective, and like I have actually like done the work and I've done these things, like you actually don't have unlimited time, for example, like you have to actually stick to the schedule and like kind of more refine the research in order to like get the finished product at the end that's actually feasible within that time period. So getting that experience was definitely how I learned about the area, is kind of being able to go to someone to be like, hey, focus, like you need to actually just look at this one thing. So that was really helpful.
Great. I mean, it's interesting to see too, it for all, I think particularly then Weixi and Rebecca, you were taking your public health skill set and then applying it to a really different context of this kind of policy or legal context. And Erika, maybe yours was a little bit more within sort of public health, but like very applied into what are we going to do with this knowledge. So that I'm glad that you were able to have that experience in your internship. I'm curious also about the partners and stakeholders that were engaged in your project. What did that engagement look like, and what was the maybe tell us some of the benefits of stakeholder engagement in your projects or limitations?
Yeah, so there's some the partners and stakeholders engaged with the work with the Justicia. There are a government and local communities and some private sectors. Because I'm in the environmental justice team. And then my preceptor is, I have two preceptors. One, she's a lawyer, and the other one, she's a political scientist. So they work mostly with other lawyers and also with people from the Colombian legal system. And I'm working with like university professors in getting the data and getting understanding their research and kind of like translating, as collecting them and then translating into practice. Yeah, so so I didn't get to work too much with the government. It's also because I wasn't in the country at that time, and also not too much with the local communities. Me myself, I connected mostly with the university professors. Yeah.
I can go next. So for our project, I was tasked with basically analyzing the transcripts of a number of interviews conducted with various stakeholders in the Caribbean region. So these were all interviews held with public health stakeholders, disaster response stakeholders, people who work for like ministries of health in Barbados and St. Vincent and the Grenadines and places like that, and also people who are living with non-communicable diseases and kind of talking about their experiences during disasters, managing their health conditions. I think maybe like a limitation of my project was that I came onto the project after interviews were conducted. And so like it was my job to just analyze the data. However, we're still collecting data and I hope to maybe hold some interviews myself soon. So that's really exciting. But but I still think I benefited from just, you know, being able to analyze this data and like seeing the responses that these stakeholders are giving and sharing their experiences. Like I think there's a massive strength in just seeing it, you know, even though it's just on paper and not holding the interview myself.
So because my internship was so unique in that it still doesn't really have a set structure, the task that I originally had started with, and this is relevant because I was also hired as an associate with the NGO, which I'm very excited about. But so that meant that my internship project kind of changed halfway through the semester, which was totally okay. But the original task that I was given was to basically create a a taxonomy and like list of all of the rules and rules of procedure in different NGOs, or for NGOs for how they could participate in different UN processes. And that can be the big ones like WHO, or even like some of the smaller subsidiary organs. But basically, this document does not exist. Like there's no such thing as a big list of like all of the ways that the NGOs, especially like climate NGOs, could get involved in UN processes. So my particular internship didn't have stakeholder involvement because it couldn't. It was really just literature review and reading a lot of legal documents and putting a lot of lists together and making sure that all of the words and facts that I was pulling are correct, because that's all very important, because I wouldn't want to put something in this big document and be like, actually, no, you actually can't go vote in these meetings. Like, that's actually not okay. Like, you know, you need to be able to actually make those differences, and because there's a nuance to that. So it was interesting, but did not really have any stakeholder involvement.
Great. With just you know, a minute and a half to go in this session, just any last reflections, especially on this comparative perspective? You're now kind of centered back in the US. Do you see differences in how climate change and health are treated in the country where you were virtually working compared to here?
It's definitely a more imminent threat in Trinidad and Tobago. We think of island countries that definitely are experiencing the more immediate effects of climate change, sea level rise, extreme heat, all of those things. Definitely more of an immediate threat, and definitely puts in perspective how privileged we are to not necessarily be living in an area that is that imminently close to really, really bad harm.
Weixi?
I was going to say, for me, it was, for example, in Colombia, like the court can make a decision, but then the effectiveness of the decision remains a problem. It's limited by administrative difficulties of the respondent authorities, and also lack of governance in some regions. And also there is some continuing armed conflict, or just crime, high rates of crime in certain regions, and also illegal mining activities, and also some wastewater treatment, or all kinds of different problems is kind of limiting the effectiveness of the decision that the court makes. So yeah, so I think it is quite complicated and difficult in Colombia.
Thanks. Erika?
Yeah, I would really just second everything that Rebecca said. I mean, we did our internships in similar regions, so really just seconding everything that she said. And yeah, the region that I did, the area that I did my internship in, you know, is so much more prone to really like immediate severe threats of climate change. And I think there's just, because of that, there's a bit of frustration in terms of policy action, or just any kind of action in order to either mitigate or adapt to these effects. And I don't have like a solution or anything to present. It's just something that we should really be, there needs to be a really concerted effort, I think, globally to tackle this issue. But I'm sure I'm just preaching to the choir by saying that.
It's always good to have the reminder. Great. Thank you so much, Rebecca, Erika, Weixi. Great job. We're going to shift over now to our next panel on communicating climate and health issues. We have Caroline Erickson, Natalie Henning, Nora Massie, Ian Reilly, and Adriana Ballinger. Caroline.
Yeah, hi. I'm really excited to be kicking off this section of the talk. So I'm Caroline. I'm a senior in Yale College, majoring in environmental studies, concentrating in human health and the environment. And I'm also in the 5-year BA/BS MPH program. So I was really fortunate this summer that I joined my project right at its beginning. And this was kind of an idea that the health department decided to address just because they found essentially a gap in the knowledge of what they were finding, what they were reading, the research that was coming out, and what residents of like shoreline communities were believing. So despite all the great research, people are still in Connecticut, especially along the shoreline, a little hesitant to believe the science. So we wanted to develop a project that addressed this in a way that was a little less scary than just jumping headfirst into a bunch of literature. So the main goal of this project was to interview people in the community, get their human stories with climate change, and then disseminate that into the wider public to kind of show people that this is not necessarily something that is super out of touch, but it is right now and it is affecting our community presently. But yeah, so we spent a lot of time interviewing towards the end of the project, or towards the end of the summer. We started having communication or talks with BCTV, which is our local like television station, to hopefully get this information out there a little bit more. And this project is still going on, so we're still running interviews and kind of collecting data in that sense and working to disseminate it. But yeah, this is a super exciting project and I had a great time this summer. So thank you.
Thanks, Caroline. Natalie.
Awesome. Hi, thank you, Laura. And again, thank you to the center for putting this together. It's so great to hear what everyone else was working on this summer. But hi, yeah, so I'm Natalie. I'm a second year in the MPH program in the Department of Chronic Disease Epidemiology and concentrating in data modeling. I interned with Montana Health Professionals for a Healthy Climate this summer. They're a very small nonprofit organization, and their team is led by Doctors Lori and Rob Bryan, who unfortunately I don't think are here, but they're completely phenomenal and inspiring and are doing so much to move the needle in their state. And I could go on and on about them, but their organization's mission and their goal is really to use the voice of health professionals in the state to push for climate action. So it was really interesting to see how they're doing that in a more conservative environment where climate change can still be a very challenging conversation to have. So I was helping them in a variety of capacities, but I guess the largest project that I did for them was a video project. So I also conducted interviews similar to Caroline with health professionals, students, and members of other Montana climate organizations on different climate topics such as climate communication, climate action during COVID, how to get involved in the climate movement, a number of topics, and edited and produced 6 videos and trailers. So I was really excited about that because I guess in my experience, and some people might be able to relate to this, I think working in the climate space can sometimes feel very slow and frustrating. And so hopefully by producing these videos, I was able to provide a way for Montana health professionals to easily communicate important information about climate that's coming from members of the community who are highly respected and well-versed in this area. So that was a really exciting project to work on, and I'll stop there and pass it along.
Thanks, Natalie. And I think at least one of the videos is already up on the website. So if you want, feel free to drop the link in the chat for folks to take a look at.
Yeah, sure.
And Nora.
Yeah, hi, can everyone hear me? Great. Okay, my computer is having sound problems, but hi, I'm Nora. I use she, her pronouns. I am in Yale College. I'm a senior double majoring in English and environmental studies. And I had a really wonderful opportunity this summer to work with really like 2 organizations at the same time. So I was working with Save the Sound, which does a lot of like regional action on climate. They take multiple angles. They have sort of like an environmental law angle, a kind of environmental justice community organizing angle, and then they also do like more scientific research around the Long Island Sound and water quality and land quality. But I also got to work with Health Equity Solutions, which is a Connecticut nonprofit seeking to close health gaps in Connecticut. So Connecticut has among the largest health gaps in the United States, health disparities. And so my main project was really working with these two organizations, as well as I got amazing and incredible feedback and help from the Yale Center for Climate Change and Health on developing a climate and health module that I've shown a few slides from here. So basically Health Equity Solutions has a curriculum that they can, adapt to any particular sort of business or community organization that might want it, that gives basics on like what health equity is and how it relates to people's lives. And they wanted to have a sort of climate justice module. And so I spent the summer developing that with them. And I also helped Save the Sound's climate advocacy team on projects like when I first joined, the last couple of weeks, I joined in late May and June were the last few weeks of the Connecticut legislative session. And so I really dived into a lot of bill tracking and advocacy right at the end of the session when there was a big push to get things done before everyone went on a break. And then throughout the rest of the summer, I was working on more local initiatives in Connecticut, such as helping cities in Connecticut declare climate emergencies. And stuff like that. And so it was really a wonderful experience being able to work kind of at the intersection of this issue with so many different organizations and so many different wonderful people.
Great, thanks, Nora. Ian.
Hey, everybody. So yeah, my name is Ian. I worked this summer, I am at the Yale School of Public Health. I'm a second year in the public health or in the health policy department. I concentrate in climate change and health. I spent the summer working with the Connecticut Governor's Council on Climate Change, or GC3. And I was with the Equity Environmental Justice Working Group. I was their Connecticut Climate Justice intern. So throughout the summer, I did several projects, small and large projects that were related to building climate justice, either in Connecticut, and actually one project in Mississippi that was for a civic engagement group built around democratizing the energy sector in Mississippi, which was pretty interesting. But the main point of my project was basically finding a way to help build climate change resiliency at a community level. And by doing so, giving more power to community members and community leaders in the climate change building process. And the point of that is to help promote building climate justice and understanding that climate change will affect, does now and will affect especially marginalized populations more severely. And so the point of the project was to find ways to kind of address this. And one of the ways we found is that when we give power at the community level, instead of the top-down approach, kind of working from the grassroots bottom-up approach, a lot of communities, they already understand a lot of the issues they're dealing with, and sometimes they just need some of the tools to address those. So what we did was we made the main project was what I have listed here on the left. This is my cover page. This is my photo. So I'm proud of this. This is actually from when Hurricane Henri almost hit New Haven. But this is the Connecticut community level climate change resiliency assessment and prioritization plan. So the way we saw it, there's already several climate change resiliency guidelines and guidances that you can find that exist. So what we went for instead was a way that communities can assess their own vulnerability to climate change. So the climate change resiliency assessment portion is mostly a vulnerability assessment that allows communities to look at their critical infrastructure, their vulnerable infrastructure, things like daycares, schools, hospitals, their vulnerable populations, and also their environmentally exposed populations. So these would be populations that might not be necessarily vulnerable populations, but they maybe are located closer to, like the seaside, and so they're vulnerable, for different reasons. So basically, it allows communities individually to look at their specific vulnerabilities to climate change, and then gives them a list of steps on how they can engage with their community members, and how the city planning committees can engage with those community members, identify leaders in the community, and kind of build this trust and network of knowledge within the community, to come up with the second part of this, which is the prioritization plan. So to come up with a list of ideas that they think would be useful in addressing climate change, and that should be prioritized based off of their community knowledge and the knowledge of climate change that we kind of gave guidelines on how to build in the community.
Great.
And so the final result would be.
Finish your sentence. Go ahead.
Oh, I'm sorry. And then the final result would just be a list of priorities that could be put forward to the planning committee.
Great. Thanks, Ian. Adriana.
Hi, my name's Adriana, and I'm a Yale College sophomore. Should be a junior, but I took a year off during the pandemic. I will be an environmental studies major, and this year I'm also a Yale Center on Climate Change and Health student associate. So my project title was Municipal Tools for Extreme Heat, and the two organizations that I was interning for were the Yale Center on Climate Change and Health, and also UConn's Connecticut Institute for Resilience and Climate Adaptation. So I was working with Dr. Bosey and also Dr. Wozniak-Brown from Circa. And they were both fantastic preceptors. I want to start with that. So I was very glad to have the opportunity to work with them and their team, and just to learn from their projects and past experiences. So I think it's very important to start with the fact that in the US, extreme heat kills more people per year than any other weather-related event. And many Connecticut municipalities are not adapted to extreme heat. So there are many vulnerable populations at risk during these extreme heat events for heat-related illnesses and other adverse impacts. So our project's goal was to determine the climate adaptation needs of Connecticut municipalities related to extreme heat, and also to provide municipal leaders with tools that address extreme heat vulnerability at the local level. So my main project was to develop an extreme heat toolkit for Connecticut's municipal decision makers, mainly local public health and emergency management officials. So I did this by researching existing extreme heat response plans from other states, recommending short and long-term policy and planning actions, and adapting the most relevant heat response resources. And I also acted as a research assistant for qualitative interviews we conducted with Connecticut municipal leaders, such as the emergency management directors I mentioned. So we were just learning about their existing strategies for responding to extreme heat. And the project is still ongoing. Dr. Bosey and Wozniak-Brown are still conducting interviews, and the toolkit is still in development. But I just wanted to say that through this process, I became much more familiar with Connecticut's municipalities, towns, and generally government structures, and also gained knowledge about qualitative research design and methods, climate health, of course, and the relationship between urban planning and public health, and also environmental justice.
Great. Thanks, Adriana. Okay, so shift back to our panel cover and invite you for a discussion. So first, climate communication is hard. and many of us scientists don't do it very well. It's not, so you, through your internships in various ways, you were able to dig into this. So, so what advice do you have? What, have you gleaned some best practices around communicating around climate change and health, and what makes what are the qualities that make that best practice effective, do you think?
Yeah,
yeah.
Okay, I can kick it off. Yeah. Well, like I mentioned in my intro, it was really interesting to see how my organization operated in an environment that tends to be more conservative and has unique subpopulations that have legitimate concerns about what it means to transition to renewables or change agricultural practices, et cetera. And so in terms of being an effective communicator, I think what I learned and what I heard over and over in interviews that I conducted is first that when you're having a conversation with someone, the goal shouldn't be to convince them of anything. It's really, the goal should be to establish a connection with that person and to establish some level of trust. And second, that it's very important to listen, which sounds so obvious, but like what I found, and kind of to my surprise, was that almost no one that I spoke with was on the end of the spectrum that is climate deniers, and that most people did acknowledge, at least to some extent, that this is happening and we can see it happening. And the point though was like, and where the conflict came in is how do we handle it? And so it was really important to listen to the communities, for example, like ranchers who their livelihood by and large depend on the climate, and for whom climate action is in their best interest. And so sometimes we wouldn't even use the words climate change in a conversation because the point was really, not to get everyone to agree that climate change was happening, but it was finding commonalities and finding how we can incorporate all of the economic and health concerns that people have into finding solutions.
Yeah, my project was a little bit different, but I think some of the same things really applied. I think in trying to communicate sort of like climate change and the health intersection, something I really worked on this summer was looking at like local examples of ways that like either initiatives that people who, the ordinary person in Connecticut might have noticed. For example, they might have noticed that the bus they take every day now says it's an electric bus, and talking about the way that like climate and health is a problem in their everyday lives as it is now, and ways that it can be implemented as solutions that can be implemented into their everyday lives, to kind of concretize what seems like to a lot of people, I think, a really big abstract and like not urgent or not immediate issue that's right in front of them.
Yeah, I'd say one of the biggest things that I found to be effective is, it also sounds pretty obvious, is don't make assumptions when you're starting to talk to people. Unlike Natalie, we did run into a couple people who told us we were wasting our time and money. So it was really important to go into those conversations with a super like level head, and also with the body language and phrasing of questions that makes it sound like you have something to learn from them as well. Just because that makes them feel more a part of the conversation. And I found that to be a lot more productive on the whole.
Adriana or Ian, thoughts?
Yeah, I can go. So when we were interviewing the municipal emergency management directors and other officials, what we found was helpful was to reference like the heat waves that had been occurring that summer, because that was extremely relevant to obviously our project, and also helped us frame the questions in a way that made it very relevant to them as well. And we also realized as we were conducting our interviews that many of the emergency management directors were not familiar with the language of climate adaptation that we had included in several of our questions. So something important that we ended up discussing was how we could better adapt our questions and our language to their experiences. Because we went in sort of assuming that they would know what this means, and that we wouldn't need to provide a lot of explanation. But I think that really helped us recalibrate and make sure that the way we were communicating our questions helped them and helped us.
And I would just probably follow up pretty similar to what Adriana said, which is that one of the things that we found in the whole point of our assessment was that was community engagement, was trying to make the language and the scenarios as relevant to the people in the communities as possible. So things like we talked about maybe adding crowdsourced mapping so that we can see, okay, well, these are the roads that flood when there's heavy rains. This is only going to get worse. Who are the people that are going to be affected by these? Who's already affected by them? So it was really just like part of the communicating is just listening. And I think that's a big thing that policymakers and climate change scientists can really take away from resiliency efforts and from climate change awareness.
Great. I'm listening to people, meeting people where they're at, some basic, as you all said, maybe some basic sort of human lessons, but sometimes you forget them in the moment. Thanks, that was great. I'm also curious if any of you thought more particularly about different strategies for different target audiences. We know we need to segment our messages for different audiences. Did you learn anything about different audiences through your work and make any adjustments to accommodate these different audiences?
So I can think of two brief examples. One of them was I ghost wrote a op-ed for my preceptor, for my supervisor, and we just I think a big part of it was just tailoring the language of it so that because we put it in a local newspaper. I think it was the Hartford News, and so it was tailoring the language so that it was like a language that was easily digestible to the general community, and also a big part of that was I was ghostwriting, so using kind of his perspective and his voice as kind of like an existing community member and trusted community member. But I think a big part of it was just tailoring it to the audience, who's going to be listening, and making sure the language and the vocabulary you're using is digestible, regardless of who you expect might be consuming.
Anyone else?
Yeah, I can jump in. So a lot of our project, or my project, was focusing on people who may be resistant to listening to climate change science. So a lot of the work we did in general, I would say, was tailoring to people who might not believe in it. So therefore, we tried, like Ian was saying, to use a lot of digestible material, like videos, stuff like that, keeping the language simple. But yeah, I wouldn't necessarily say we were targeting many different populations, because I think the whole point was to meet people where they were at and target those people who may not be as willing to buy in to the fact that climate change is going on.
Yeah, and I can, going off that, I think definitely talking to different groups of people, you find that individuals are certainly moved by different things. And for me, I think different from Caroline, we were targeting a less hesitant population. And so I think on a more emotional level, I found that a lot of people relate really well to the nostalgia and, you know, the sense of loss that is experienced, especially for people who have maybe spent their whole life in the same place. You know, I talked to people who would reminisce about their favorite ski slope as kids that no longer get snow. And, you know, not to mention people who have lost their homes in wildfires or suffer health consequences from smoky air, or are literally like moved to tears just by the thought of their children growing up in a world that potentially looks very different. And so I think those kinds of stories are very powerful and were successful for us when we were targeting a more, I guess, moderate population.
I mean, I can just jump in quickly. I think my project was significantly different in that, like, the populations that we were kind of hoping to engage were not of particularly challenging of like a narrative of climate change and health. But I think one thing that I really learned, and obviously this was not really possible in the pandemic, but I helped a lot with like the youth advocacy core, which Save the Sound has. And I think, first of all, like for meetings, for encouraging people to come to meetings and actually, you know, engaging people in conversation, I think what Caroline said about like meeting people where they're at, and that often means geographically, like going to particular locations. Unfortunately, I was all remote all summer, but my supervisor, Alex Rodriguez, who kind of works a lot on the climate advocacy, is like was driving all over Connecticut to have different meetings with young people and with like different representatives everywhere. And so I guess not asking people to travel large distances or take up large amounts of their time because people are busy and we want to meet them where they're at. Yeah.
Yeah, and I can just add quickly that since during our interviews, we were speaking to municipal leaders from all across Connecticut, we had to consider that we would be speaking to some people who were not comfortable with the idea of climate change and would see the language that we use in our interviews as off-putting if we really emphasize climate change. So we decided to really focus more on using language that emphasizes extreme heat, which is obviously part of climate change, but focusing on that one aspect, we believed would be more I suppose all-encompassing for the different types of leaders that, or the different, the perspectives of the different leaders that we interviewed.
Great, thanks. So last question, some of you touched on this, but tell us what will happen with the product that you were working on? How might your host organization use the work that you contributed toward? And maybe is it part of some kind of campaign or other kind of goal for the organization?
Sure, I can start that off. So kind of like I mentioned, there's a hope that this project is kind of more long lasting and living and breathing. And so the interviews will continue, hopefully. We are still in communication with BCTV to try to get more of this broadcasted on the local level. And also we just kind of have the hope that in addition to targeting people who may not be super believing in the science, we're hoping that continuously kind of making this information available, these human stories available, that others in the community will also be motivated to like make efforts towards improving like carbon footprints or just living a life that's a little bit more like cognizant of climate change.
I can say that my project is kind of an ongoing project between Health Equity Solutions and Save the Sound and the Yale Center for Climate Change and Health, because the curriculum that the Health Equity Solutions develops is so dependent on what the actual organization is who they're going to work with. So like an organization like a company or a community organization or even a school can request particular parts of their curriculum, and obviously, you know, they have every group has different time constraints, and so it continues to be an ongoing project.
Yeah, so I produced 6 videos that are about 12 minutes each, and I also produced trailers for each of those videos. So my organization is posting these on their website and YouTube channel, and because I interviewed members of other climate organizations and also students who are advocating for institutional change at their schools, the videos will also be used for those other organizations. And then Montana health professionals may also incorporate them in grant applications.
I left off my internship with the idea that the final project was going to be shared with my supervisor's team with the rest of the the climate justice and adaptation working group. And then so hopefully that'll maybe get used into some kind of state level policy or planning policy. And then that it could potentially be used in other states because a big part of it was listing Connecticut specific resources to help identify vulnerable populations and to kind of help address some of the resiliency issues. So yeah, the hope is that it could be used in some kind of a state level planning scenario.
And my project is still ongoing, but once it's completed, the municipal toolkit for extreme heat that I was working on will be distributed to municipal leaders around the state so that they can have those resources for helping their residents and infrastructure and other parts of their municipalities adapt to extreme heat. And during our interviews, the leaders that we were speaking to actually seemed eager to see what we had developed. So hopefully it's helpful to those leaders.
Great. Thanks so much, everybody. Thanks to panel 2. And we'll move on to our final panel. Oops. All right. So I bring up panel 3, collecting and operationalizing climate and health data. We have Gwen Oliver, Max Teirstein, Trinidad Kechkian, and Katie Schlick. Gwen.
Hi, I'm Gwen Oliver. Thank you again to Laura and Mauro and everyone at the Yale Center for Climate Change and Health for giving us this platform to talk about what we did, and also for organizing the program, which was really excellent. So I'm at the Yale School of Public Health. I'm a Master of Public Health student in my 2nd year, and I'm in the epidemiology of microbial disease. So I worked at the California Department of Public Health this summer, and I specifically worked for the climate change and health equity section, and I worked with their epidemiologist. So although a lot of the people on my team worked in policy, I actually did a lot of data work for them, which is also why I'm on this section of the event. So the main thing that I worked on over the summer was this biannual update of the climate change and health vulnerability data, indicator data and narratives. And so essentially, one thing that the climate change and health equity section does is they keep up to date these data sets that are used by municipal planners, health organizations, local health departments, and also just community members, and essentially in order to create data that's in an accessible form for them to do vulnerability assessments, especially for climate change. So for example, like poverty by census tract or like linguistically isolated populations. And I also updated narratives that were associated with these data sets so that people knew what they were looking at. And I think that the other panelists will get into this as well, but this is really critical because people need information to make decisions. And so especially at the local health department level, people really depend on these data sets and on the California Department of Public Health to provide them with this information for planning purposes. So it was a really incredible experience. And yeah, thank you.
Thanks, Gwen. Oh, there we go. Max.
Hi, everybody. Thank you so much for coming today. It's so nice to see some of your faces. I'm just gonna jump right in because I only have 2 minutes and I had a lot of projects I was put on. I worked this summer for the Center for Community Engagement, Environmental Justice and Health. It's a mouthful. We call it SEEGE for short. And all of my projects had something to do with environmental justice mapping. So it, just like Gwen just said, it looked a lot like layering data from the realms of public health and environmental data and climate data and socioeconomic data to identify where the most vulnerable communities in an area are. And there are lots of different indicators for capturing that kind of vulnerability. And part of my work, especially one of my projects, was putting together a white paper that surveyed sort of current environmental justice mapping tools that are available that layer these kinds of data and identifying gaps, indicators of vulnerability that should be included, but maybe aren't right now. And that white paper will be published soon on the National Wildlife Federation's website. It's going to be presented to the White House Council on Environmental Quality. That was just a really awesome project that I worked on. I also participated in a project for a publication called Consumer Reports that I'm sure some of you have heard of, that maps, and that project was mapping out where Amazon warehouses were located across the country, and sort of trying to make an argument that Amazon disproportionately cites its warehouses and facilities in areas that are primarily Black and brown and low income and have low educational attainment. So particularly vulnerable areas. And we were able to find that actually is true based on the data. So I worked on a host of other projects, including updating Maryland's statewide environmental justice mapping tool and their park equity mapping tool. I did some community engagement in North and South Carolina, which is also mapping tool related. But yeah, I'm excited to answer any questions and talk a little bit more about that in the Q&A portion.
Thanks. And Trini.
Hi, everyone. I'm Trini. I use she, her pronouns, and I am a fifth year student at the School of the Environment. I'm pursuing a Master of Environmental Management. I was a Yale College undergrad before that, so I graduated in May, and I studied environmental studies and global affairs during my time at Yale College. This summer, I interned with We Act for Environmental Justice on their cooling center audit project. So We Act is a membership-based organization that has been fighting for the health and well-being of low-income communities and communities of color in Northern Manhattan. So that's Harlem, Washington Heights, and Inwood for the past 30 years. And the project I was working on was about adaptation strategies for extreme heat events, which are a pressing public health issue in New York City. The New York City Cooling Center program provides public spaces for residents to go and cool down during extreme heat events. And in the summer of 2019, We Act conducted an audit of about 50 cooling centers across Northern Manhattan to assess their effectiveness, and they found that they were underutilized, lacked sufficient wayfinding, didn't consistently offer amenities or activities, didn't have food or water, and sometimes even lacked a working AC. And so they compiled all of this into a report that they've used to organize and advocate for the improvement of these cooling centers. So during the summer of 2021, We Act wanted to conduct a second audit
of the cooling centers across northern Manhattan using an improved auditing form developed by a team of students during the spring 2021 clinic in climate justice and climate policy, law, and public health. And so my job was to coordinate the audit project and actually make it happen this summer. So that included training and coordinating volunteers, fine-tuning the auditing form, and collecting and analyzing the data.
Great, thanks, Trini. And Katie.
Hi, everybody. My name is Katie Schlick. I use she, her pronouns, and I am a senior in Yale College majoring in environmental studies. This summer, I was really excited to work for the New Haven City Plan Department, and I was supporting, in general, their initiatives, planning for climate and health and building back after COVID-19, and then also just really supporting their community outreach. So I had kind of 2 or 3 main focuses. The first one was the City Plan Department. First up, just as a little background on the City Plan Department, it's an amazing office that works closely with economic development and a bunch of other city departments, some different boards and commissions like Planning Commission, the Zoning Commission, the Historic Society, and then community management teams, alders, and residents to facilitate the meaningful physical development of the city alongside sustainable land use and economic and social policy. So I supported the City Plan Commission in its public outreach efforts, and kind of as they transitioned into doing them over Zoom this whole year. I also reformatted and updated the zoning code so that it's more accessible online for people. And then I also helped out with framing the Long Wharf Responsible Growth Plan in the context of community engagement needs, as they've changed a lot since the plan, which you can see in that, like on the right side of the slide. That's kind of the vision for redeveloping the Long Wharf area and revitalizing it. And that plan was like many, many years in the making, but I think a lot of, as we know, like a lot of community needs and just the physical environment has changed since the pandemic too. So I was kind of reassessing that in all those contexts. So a couple of my key takeaways from the summer were, first, just it was an amazing experience to understand how local government operates and how many openings there are at such a local level to create real tangible change. And I saw that firsthand in like the 4 or 5 hour long city plan commission meetings and hearing the public testimony. Anywhere from that to when people would submit other forms of testimony or show up to neighborhood walks that we did as we were looking at the neighborhoods and thinking about how plans could adjust to fit the needs that we're seeing on the ground. I also have a huge appreciation for how influential and critical a city plan department is in general for tackling the climate crisis and building back from COVID-19 with equity and justice at the forefront of that conversation. It just, the built environment so much reflects like how we're able to build community and how we're able to prioritize equity and justice. And so it's just like, it is a longer time scale, but it's so meaningful and important. And then third, I would say I really appreciated my preceptor, Jamie Stein, and the cohort of fellows. It was also affiliated with the Dwight Hall Summer Fellowship. And it was just amazing to be able to all work together to go from this book, Planning to Stay, and think about how we can hear the voices of the people in the community on the ground, and then match that up right to what the plans were that we are creating and how they're being implemented in the coming months and years ahead. So thank you.
Great, thanks, Katie. All right, so a few questions. Can you, so I think I'll frame this out a little bit bigger than data, and also say that it's around kind of community planning and community engagement. You know, the way that you do it really matters. The way that you're collecting and using the data and presenting the data, or the way that you are making decisions for or with communities, like that process really matters. And we learned that through principles of environmental justice. So can you talk about observations that you saw about maybe ways that went well, or challenges that you saw in applying those principles and practice in your projects? Anyone can jump in.
I can talk a little bit. I didn't have a lot of direct community engagement just because at the California Department of Public Health level, they are almost like a federal government institution because they're so big. But something that I did see that was really successful was that a lot of the planning and work that the climate change and health equity section did involved community partners. And so that's especially essential because it is an equity organization. And so it was really important for them to kind of like go into communities and partner with community groups and say, like, what do you need? Like what resources are lacking, or like there's been discussion of like weatherization of houses. And that is really critical, but you know, like, is that something that people are invested in? Is that like the primary thing that they need? And so I think that like a little bit less directly related to my project, but just in general, I think the team that I worked on was really excellent at engaging with partners who were directly plugged into the community and knew what was needed.
Yeah, I would just add also, like, I have found that when community partners play a pivotal role in data collection and on the project, for example, I worked on a project updating the CCCH's park equity mapper, which basically assesses communities' relative access to green space. That was a much more successful, I think, endeavor ultimately than was this kind of broader data set work that I did, which for the Amazon project, which involved data from all over the country. The data was drawn from the National Environmental Justice Mapping Tool the EPA has called EJ Screen. And a lot of that data is modeled, but we worked with a group called the Baltimore Neighborhood Indicators Alliance in Baltimore to put together a different report that'll get published soon on park equity and health outcomes. And that data was really rich, and the community partners could speak to its accuracy, whereas the national data, a lot of which was modeled, and that data is all coming from kind of the Census Bureau, which is crucial, of course, but not a community-based organization. It's huge in scope. So that data had a lot more inaccuracies in it and was a lot more difficult to work with ultimately. So I think that there's an important point to be made about how community groups actually can produce much more accurate data. And so they make for excellent partners in data analysis work.
So I can comment also here. There were kind of two levels of community engagement in my project. One was me working with volunteers who are members of the community, and the second level being the volunteers going out to conduct the surveys of the users of the cooling centers, who are like another level of community. So I didn't really quite get to be communicating with the actual users of the cooling centers, but my strategy for working with the volunteers was to just make them feel heard and actually incorporate the comments that they had about the audit into the project. So the first training session that I had, it wasn't the smoothest, but I think because of that, I was able to create a much better process and a much better audit form to actually go out and get better data for the project. And so a lot of the comments were because this project involved human subjects who were the users of the cooling centers, we had to do a consent form before doing any surveying. So the consent form originally was 2 pages long. It took 5 minutes to read. It was really wordy and jargony, and you know, when we were going through that during the first training session, I got many comments about its length, and I managed to cut it down to 1 minute, a quick like consent form that still got all the information across that was necessary. And even some of the questions that were in the audit form, we got rid of or changed. We removed an entire section about for the staff survey, because we felt that, well, first of all, a lot of the locations, especially the public libraries, didn't allow us to even survey. And we also felt that surveying staff would be a little bit of, we would encounter some obstacles in that, because staff would be suspicious of like what we were going to do with the information, whether we were going to, you know, attach a name to the form, or whether we were going to get them in trouble, which was not like at all the purpose of our audits, and they were completely anonymous. But yeah, because of the feedback that I got during that first training session, I kind of treated that as like me talking to members of the community, which I was, and incorporating their work. And I got some really great, like, I got a nice email saying like, thank you so much for like working so hard to incorporate our comments. Like, you really made us feel heard, and that meant a lot to me. But to kind of comment on what Max just said about communities developing more accurate data, I kind of encountered not the opposite problem, but I think it depends what kind of data you're really looking for. So for me, I think, you know, training, I think I had like 25 or 30 volunteers to go out and do audits. You know, there's going to be variability in that, and not everyone's going to conduct the survey the same way, despite the trainings that I did. So that was one of the obstacles that I think I encountered.
I would add for the city plan department as well. I think there were a couple different ways in which community engagement and collecting data from there was prioritized. So one project that another one of the fellows was working on was the redevelopment of the Strong School neighborhood. And so I came in at a time when they had already worked with the consulting firm to develop a feedback survey. But then in terms of distributing the survey, it's a little tricky with COVID. But we decided that like papering was the best way to do it. And then there was like a QR code that people could scan. But yeah, we distributed that kind of pretty much by hand to the local public library in Fairhaven, to the summer schools that were running with New Haven Public Schools. They went up and down the street at the main to like Grand Avenue to all the different local businesses, and they went with people from that neighborhood so that it was received well. And then there was like a couple, we drove the whole neighborhood and put it in all the mailboxes and stuff. So this idea of like data not just being the statistics, but also like the lived experiences, and then the open comments from people. And then in terms of the city plan commission, which I mentioned before too, one big thing that came up this summer was meeting over Zoom. And so we had to make sure that it was accessible for people, so people were able to send in public comment that way. And then also just, there was like public comment periods open at the meeting. And if we didn't get to one meeting, it would open up for the following meeting. So there was a lot of opportunity for engagement there. And then with my project with Long Wharf, all the fellows are working on building out community profiles around these already established plans. So in theory, there was community input in the plans to begin with, but we were trying to situate that within more of the data that we had from Data Haven, that we were pulling from community management team meetings, from talking to the alders, from talking to residents. And another huge piece of it was trying to then, at the end of it, we're packaging the profiles in a way that are useful for the community members themselves and for the neighborhoods themselves, so that they can use that in future conversations or future planning commission meetings or whatever might be helpful there.
Trinity, do you want to jump in?
Yeah, I wanted to comment on data not just being the actual survey or whatever you're collecting, but also the lived experience. So I, after every heat wave, I would do a debrief with the volunteers, and I would say that their comments are even more valuable than the actual audits, just because a lot of the audits they weren't able to conduct, or they got lost and went to a different location, which is data in itself, because then that means that they're not easy to find, or they weren't able to conduct it because there were no users there, or their interactions with the staff were a little bit hostile maybe, and they wanted to talk about that. So I think I think that's a great point, Katie.
With just a couple of minutes left, I'll ask you what Gwen kind of pointed to, which is, do you see ways that the work that you did, or that this data will inform policy?
Yeah, since you pointed to me, I can go first. Yeah, I think that it's really, and I also just wanted to tie this back a little bit to the last question, which was about like community engagement and equity, and tie it back to data, because I think that something that is overlooked sometimes is that data aggregation or disaggregation can hide or highlight equity issues. And I think that that's really what the team that I was on was specifically trying to do, was to disaggregate data in a way that really allowed you to look at like who is most vulnerable. For example, I brought up earlier, like linguistically isolated populations by census tract. So if you're trying to implement like fire safety in a region, but there's an entire like census tract where like households don't have someone who speaks English in like at a certain grade level, then they might not be able to read or understand the materials that you're distributing. And so that's something that's really critical for the people who are doing work in that area to know. And that's something that if you just looked at like linguistically isolated populations in all of California, you wouldn't know. And so I think that we really aim to provide that disaggregated data that allowed communities to make decisions based on the information in their region and in their community, down to a pretty narrow level. So I think that that's how my work contributed to community decision making.
I can say for the New Haven City Plan Department, I think what I saw more this summer was less on the side of building new policy or plans, since that's such a long time scale. Again, like the plan department, for the most part, with the exception of like approving some zoning things, is operating on like a 20 or 30 plus year time scale. So like the vision that you saw of long work is absolutely beautiful and amazing and so exciting, but that will not be manifesting for a long time. But I think just as important as the creation of policy or plans is the implementation of it. And so now, as we're kind of past that bridge of, they've developed the plan, making sure that we're constantly keeping in check how times have changed. I mean, the plan was only like drafted and finalized a couple of years ago, but all of New Haven's priorities, everything has changed. So doing that constant, like iterative process of reassessing and then thinking about what are the new needs that have popped up, and as we're implementing it, is this feeling right? Can we go back to the drawing board? It's just like an iterative process. And I definitely think that like data, whether it be lived experiences or from the census tracts or stuff that we're getting from Data Haven or from the City of New Haven GIS system, all of that is really important and critical in that assessment.
Great. So I think I'm gonna leave the last 5 minutes for any audience questions. So thank you, panel 3, and maybe just give kind of the virtual thank you applause to all the panels and all of our great interns. I'll give a loud applause since I have the microphone, and open it up for questions. I don't see any in the chat, but would welcome anyone to raise their hand and jump in or add it into the chat. Anybody?
We've got one in the chat about tips for securing your internship.
Oh, that's a good one. Well, it's a good plug for our climate change and health internship program. So one of the reasons that we built out this program was that we realized that climate change and health is a fairly new field, and that sometimes it's hard for students to find those projects. So we've worked with partners of the Yale Center on Climate Change and Health and others in our network to identify these projects, and then we make them eligible now to all NPH students, environmental studies major students, and our Yale Center on Climate Change and Health student associates, who then apply and go through kind of a matching process. So that's one strategy is to work through our process. But if others have other advice for securing them through kind of traditional means, that'd be great to talk about.
I feel like no one wants to hear this, but networking is your friend. And I would count this as networking. Like being a student associate last year is how I heard about this program. And I doubt that I would have been able to find something that was as tailored to what I wanted to do if I didn't kind of have an existing network here at Yale. And the people that I know who found internships that were more tailored to their wants and needs found those typically through advisors or coworkers or other things like that. So there's a lot on Indeed and stuff like that, but I think it tends to be more successful and more interesting if you find something through someone else.
Yeah, I was in the clinic for climate justice and public health last spring, and that's how I heard about this this internship. So agreed on the networking and finding connections.
I would just second that course for anybody who has not heard of it yet. I'm sure that most of you have, and many of you probably are in it right now, but it's an amazing, amazing course, and ended up actually really giving me kind of the framework for what I would want to do with like most of my or the next few years, I guess. I had never heard of environmental justice mapping before that class, and now that's like what I am writing my senior essay on, and what I spent this summer working on, and last summer too. So would highly recommend that course.
Thanks. Great. Well, I think we'll call it a night. Thanks again to everybody for your great presentations. And I wish that I look forward to chances to see you in person sometime and learn more about it. And I hope that others do that as well. If you heard of something that you're interested in and you want to learn more, then reach out to your colleague here. So thanks everybody, and have a great night.